Hey everybody, Dr. Anthony Youn, America's holistic plastic surgeon, and today I'm going to go over with you the 5 biggest plastic surgery mistakes that you can make. Well, as you know, if you've been following me, I'm all about holistic plastic surgery and doing it the right way. There is a better way than traditional plastic surgery. And if you're thinking about going under the knife or the needle, and you ask me, Dr. Youn, what is the worst thing that can happen to me if I have surgery? I'll tell you that you can die or you can become disfigured, and nobody wants that. So my goal today with this video is to try to help prevent you or a loved one to prevent making a mistake that you're going to regret for the rest of your life. All right, so my number 5 biggest plastic surgery mistake that I want you to avoid is having an upper lip lift while you're young. Upper lip lifts are very popular and trendy procedures right now where this is a minor surgery where you remove skin from the base of the nose as a way to shorten the distance from your nose to your upper lip. That causes the upper lip to evert, to stick out a little bit, and that distance is shortened, and it creates overall a nicer contour for some people. Well, the problem with this operation is that you get a permanent scar at the base of your nose. And when you're young, when you're in your 20s, your 30s, your 40s, that scar may not heal so well. And if it doesn't heal well, you can't get rid of it. It's permanent, okay? It's different if you're in your 60s or your 70s because people who are older, they tend to scar much better than people who are younger. So that's why it's definitely a risky procedure in people who are younger. So if you're thinking about having an upper lip lift and you're in your 20s, your 30s, or your 40s, really think about it. Are you okay with that scar? And what if that scar doesn't heal well? How are you going to feel about your appearance? Are you going to regret having the operation? In my practice, I don't do this operation on anybody who really is under the age of about 60 or so. Well, the number 4 thing that I recommend that you consider avoiding is undergoing a breast augmentation using a textured breast implant. Well, this is really important because breast augmentation is the number 1 cosmetic surgery in the country. Textured breast implants have been implicated as being related to a certain type of very rare cancer of the scar tissue surrounding the implant. It's called ALCL. There have been upwards of around 500 or so reported cases in the United States, and some people have actually died from this cancer. And as of today, every single reported case of ALCL of this cancer is related to a textured breast implant, not a smooth breast implant. And so for that reason, in my practice, I've stopped using textured breast implants and I only use smooth breast implants. So if you're thinking about having a breast augmentation and your doctor is recommending a textured breast implant, just be aware that they do have the risk of ALCL, and that risk stays with you as long as you have those implants in, and there is a belief that even after they come out, that risk may continue to be with you a bit. So just be aware and be informed because you really want to make sure you make the right decision for yourself long term. Well, the number 3 thing that I recommend you avoiding, plastic surgery mistake, is to avoid making your upper lip bigger than your lower lip. So proportionally, the lower lip should be 50% thicker than the upper lip. Our lower lip in general, normal and anatomical proportions, is typically thicker than the upper lip. Now there are some people who don't quite follow this rule, like Angelina Jolie is a good example of that. Her upper lip and lower lip are about the same size. But it's very rare that you see naturally somebody have an upper lip bigger than their lower lip. And when people undergo injections to change it that way, that's when we get the quote-unquote trout pout. And I'm sure you've seen that in Hollywood. So if you're thinking about getting your lips injected, very common procedure. A lot of people do, a lot of people like it. Make sure that you keep those natural proportions the same and do not make your upper lip bigger than your lower lip. Otherwise, you're going to look like a duck. And who wants that? Nobody. All right, well, the number 2 mistake that I would like you to avoid is to undergo a permanent injection of filler. So permanent fillers are FDA approved, and that's kind of crazy because permanent fillers come with potentially permanent problems. Now, some people say, hey, Dr. Youn, I want a permanent filler because I don't want to come in every year or 2 to have filler injected. That's no fun. Well, I agree, it isn't any fun, but the problem with permanent fillers is that, number 1, they're permanent. So if you may like it today, but a couple years from now, you might not like how it looks. And number two, you can develop major complications from it, even years down the line. I know people who've had permanent filler injected into their face, and years later, the filler that used to feel soft and natural gets hard and gets lumpy. And if that happens to you, the only solution is to surgically cut it out. And that will create big scars. The final issue with permanent fillers is if the filler is accidentally injected into a blood vessel, you're screwed. There's no way to remove that filler from that blood vessel, and whatever body part is being supplied by that blood vessel can die. And people have developed necrosis or dead tissue of their nose, of their lip, and other parts of the body from injections of permanent filler. So buyer beware. If you're going to undergo injections of filler, go with a temporary filler, a hyaluronic acid-based filler like a Restylane or Juvederm. Even though you may have to have it done a year or two later, it's going to be a much safer option for you. And my final tip to avoid in plastic surgery is you will want to avoid choosing a phony plastic surgeon. Plastic surgery is the Wild West of medicine, and there's so many doctors out there who are masquerading as real plastic surgeons, and they just are not. So make sure your doctor is certified by the American Board of Plastic Surgery. Make sure that doctor is a member of the American Society of Plastic Surgeons or the American Society for Aesthetic Plastic Surgery. Anything less, you may be putting yourself in the hands of somebody who is masquerading as a real plastic surgeon but doesn't have the training or the credentials to actually perform your surgery safely. I hope this has been helpful for you. I'm Dr. Anthony Youn, America's holistic plastic surgeon. Take a peek at this other informational video for more information for you.